Now, if you want proof that Cuba really has got something to teach the rest of the world, how about this place? This is the Latin American Medical School, where students come not just from all over the immediate region, but from all over the world. On the quiet, there are 71 students here from the USA, and they've come for 6 years of free medical training the Cuban way. Now, Carola, you're from Indiana in the USA.
See?
So how come you're studying medicine in Cuba?
Well, to put it simply, I like the best, I wanted to receive the best, and I wanted to serve my people with the best.
Right.
So I came to Cuba to learn things the way they do. Instead of healthcare, it's human care in Cuba.
Right.
So I wanted to learn that the way that they teach it and take it back to my community.
Right. Now, how does it sit, your presence here with the embargo? Because America, as far as I know, doesn't want anything to do with Cuba, so how come you're here studying?
I'm kind of bobbling on the fence.
Right.
You have certain people that feel that Cuba is a communist place and I shouldn't be here, but then you have people that advocate good health care and they want their community to be benefited from people like me.
Right. You're one of 71 students here, from what I'm told, right?
Okay.
So give me an idea of the other places in the States that some of your kind of American colleagues
A lot of people are from New York. The
Right.
organization that gets us together, that does the application process, is located in New York.
Right.
IFCO Foundation, so they bring us down here. A lot of people are located in California.
Right.
There's a couple of people from Georgia. It's really a wide spectrum of people.
Well, tell me
from
about the kind
everywhere.
of racial mix in those students.
Ooh, majority of our delegation is African American.
Is African American?
Yes,
Right.
definitely minorities. We have a few Caucasians, and we have some that are Jamaican.
Okay.
You know, for that are Caribbean.
Why do you think that's the case, that the majority of American students here are African American?
Money.
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 Right. I mean, at home, if you wanted to study medicine, how much should you be paying for your 5 or 6 years
The
training?
average right now is about $200,000.
$200,000.
$200,000
Wow,
you're looking
okay.
at, and that's not even counting, you know, taking your board's licensing test.
Right. And how is it studying it? It must be quite a culture shock coming to Cuba.
It's quite nice. If you look here, the ocean is very peaceful. So those days when you kind of miss home, you can just sit there and just imagine that home is 90 miles away.
Right.
So it's quite nice.
One thing has to be said. Some of this country's admirable healthcare record is based on very Cuban factors. First, it's not a liberal democracy. So if the ruling Communist Party decides that any health policy is worth pursuing, they don't exactly have to worry about cliffhanger votes in Parliament. It's also got a wage structure that suits its shrunken national income. Here, doctors earn around $25 a month. And then there's the fact that the 44-year-old US embargo means that rationing's still in place. So, as happened in Britain during the Second World War, people tend to eat a pretty balanced diet. Those who've studied Cuba's healthcare agree that though the embargo is overwhelmingly negative, it has had unintended knock-on effects for people's well-being.
El embargo ha tenido beneficios colaterales, si se puede decir.
The embargo has brought collateral benefits. It's protected people from nasty habits. There's no junk food here. That's a curse to be found in the US and many other places. And as there are transport problems, people walk everywhere. They certainly aren't sedentary.
A big part of Cuba's health record is bound up with the way it treats its senior citizens, one of whom, let's not forget, is the president, who celebrates his 80th birthday in a couple of weeks. Living long is a bit of a national obsession here, and it's reflected in the 120 Club, an association open to anyone who fancies racking up 60 years. Its vice president is surgeon Dr. Gerardo de la Hiera.
Now, you're 76 years of age.
I'm 76 years.
And you're still working as a surgeon?
I'm still working as a surgeon.
Right.
I still operate. I still look for the patients, everything.
And are you aiming, you're aiming at 120 years?
When you have the hands like this, you can operate.
It's good, no?
It's a good one.
You're probably better than me.
You can do it.
Particularly this morning. So, you're aiming at 120 years?
Yes, of course. I want to get 120 years. I'm sure I'm going to get this.
You don't think it'll get a little kind of boring? 90 years, I'd be satisfied with maybe 90, you know, it's a long time.
No, 120 years.
You got any advice for me? If I want to live till I'm 120, what should I be doing?
Everything. All I'm telling you, I'm perhaps living in Cuba.
I got to move here. Okay, maybe I'll take you up on that.
Okay.
Escucha este mensaje sonero.
Cuba is a developing world country. Constricted by all kinds of rules and regulations and crushed by the American embargo, its economy is in a real mess. But the health problems it's dealing with aren't things like night blindness or malnutrition or typhoid. They're heart disease, cancer, diabetes, exactly the same stuff we worry about in the UK. If coming here and exploring the health system teaches you anything, is that there's actually all kinds of things we can learn from this place.